everybody, and welcome to today's DataVox webinar, Workplace Health and Safety Return to Work Solutions, presented by DataVox. My name is Jessica, and I will be your moderator today. We are broadcasting this webinar through Cisco WebEx events, and the audio can be heard through your PC or by calling into the phone number listed and with the access code provided in your confirmation email or calendar invite for this event. Today's webinar is being recorded on behalf of DataVox, and participation in this event indicates your consent to being included in that recording. All attendees will receive an email with the link to the completed recording 24 to 48 hours post-event. If you do have any questions for the presenters at any time during this presentation, you may submit those questions via the Q&A feature to the bottom right of your screen. This should already be turned on. Simply click Q&A and the text box will appear. We do encourage you to utilize this feature throughout the presentation, as we will be responding to your questions between each segment. If you are in need of support or have a question not pertaining to today's topic, please utilize the chat feature and I will be happy to assist you. This feature is separate from the Q&A feature and can be turned on by clicking the chat bubble in the lower center of your screen. Now that we have reviewed the features of this webinar, I would like to introduce our presenter for today, VP of Building Technology Solutions for DataVox, Mike Bebchuk. Mike, take it away.
Thanks, Jessica. Good afternoon, everybody. Thank you for joining. And we got some great information for you this afternoon on how we're helping our clients on a safe return to work. And so I'm going to share my screen with you and begin the presentation. So how do we return to work safely? I know everybody in the new norm has been working remote, and people are coming back with their committees, talking to their stakeholders. What kind of compliance, what kind of policies, how can technology be used for a safe return to work strategy? And so we're going to show you what we've been talking to our clients about today, and how some of the technology is very cost effective, very easy to implement, that you can absolutely have confidence that your environment in the new norm will be a health and safe workspace to go back to. So with that said, I'll start the presentation by showing you, in the beginning of this, I'm going to show you at a very high level what we're helping our clients with, and then I'm going to circle back and do a deep dive into each one of these thumbnails that you see here. So front and center, you see it in the news, people are deploying it almost every day today, is some type of screening protocol, and part of that is thermal imaging. And so there's different solutions to choose from. We've had a lot of success with a solution today that you can implement very easily in the lobby, right into your visitor, where your visitors come in to detect an elevated body temperature. So thermal imaging has been very successful as one type of screening protocol that people are implementing. There's other screening protocols that people are looking into, whether it's our visitor management strategy, how do people enter and exit the facility? Do I go from 5 exits or entrances for my facility down to 2? So people are talking about a number of things as people enter their building, whether it's the visitors, their employees, their contractors. And one protocol that they're implementing is the thermal imaging. The other thing that people are considering is occupancy levels. Do I need to set a certain target limit of occupancy in certain areas of my facility, whether it's my break room, my boardroom, my training room, certain floors that at one time were occupying 100 people? Do I need to set a target capacity of maybe 50 people? So there are certain solutions that can help with that in the near term. And also people are talking about utilizing some of this sensor technology on a long-term basis, where can I use it to repurpose real estate? Can I look at my space utilization and repurpose space? Do I have a conference room that I can turn into office space? So a lot of this technology is being used in the near term, such as the occupancy and people counting sensor technology, but it also has a place long term as people come back to their office. Indoor air quality, we have been talking to our clients about IAQ monitoring solutions. People are implementing air filtration solutions or air purification solutions. They want to get an idea of what their air quality looks like today. And you know, you've heard the term sick building syndrome. Well, what causes that, right? Is it the CO2 level of my space? Is it the humidity level that's causing this? Is it the particulate matter that's in my air that's causing this? So we're going to share with you what some of those indoor air quality solutions look like and how you can utilize the data in those dashboards in real time to make some informed decisions on your air quality and how your HVAC is being utilized. We did just talk about visitor management strategies. There is visitor management solutions today that people are considering, where the idea that I can send a questionnaire to my visitor before they even attend the office, and they check all the boxes before they get here. We can present them a QR code, and when they get here, everything flashes green. It's good to enter the facility. They can present the QR to some kind of iPad in a touchless manner. So there are solutions like that. There's some integrations as well that can integrate to your access control system. So we're talking to people about that. Hands-free solutions, the idea that I no longer need my access control badge to enter a facility. Utilizing near-field communication, Bluetooth wireless technology. My credentials in my phone are recognizing me as I walk into the building. The other thing is going into a conference room, the idea that I only have to use my laptop, utilize wireless technology to make presentations, to display content on the display. A lot of things are in this bucket where we can talk to you and where we have talked to our clients with respect to hands-free solutions. And then finally, whether it's thermal imaging or occupancy sensor, what I would consider 1A and 1B, right front and center is RTLS services, real-time location services. And my counterpart, Greg Smith, is going to join the webinar here shortly and discuss how people are using these services. Think about it. People come into the facility, they're in training sessions. HR gets a call the next day that someone had tested positive for a virus. Well, I want to know in real time who that person was in contact with the day before or even 2 days prior. So there's some technology that's out there today. It's a proven technology. People use it over the last 10, 15 years. They use it in a hospital setting. They use it in manufacturing facilities. They not only use it for people tracking, but also asset tracking. So it's proven technology that's out there today, but you can imagine the use case for this in this new norm. So having said that, I'm going to circle back and talk about some of these solutions individually and where we've had success and the type of implementations that we've been doing. And I'll start with thermal imaging. And I'm going to minimize this. And so I'm going to share with you guys one of the solutions that we've had a tremendous amount of success with. And the solution comes in a kit. There's an Android phone, there's FLIR technology, it's a tripod, there's a battery pack, and it detects elevated skin temperature. So think of someone coming into your facility and they can maintain social distancing from a 5 foot or 12 feet and not have to use a handheld device. And I get close to that visitor or that employee as they're coming in. I can use this fever technology where it can detect an elevated skin temperature, which is a good indicator of the core body temperature. And from that, I can get an audible or visual alert if someone is within or outside of the range with their core body temperature. So give an example how we use it. Someone comes into our building, mask on, sanitize their hands, walk in front of the device, and we get an immediate indication if someone has an elevated body temperature. Now, what some of our clients are doing, they're taking that next level of screening protocol in a lot of different ways. Some people have an HSE supervisor or nurse or safety director that gets called down to the lobby, and they have that next level screening protocol, whether it's another temperature screening. There's even disposable thermometers. So whatever environment you're in is going to determine how you want to do that next level of screening protocol. But this gives you an idea of the visual alert you get. And this specific solution comes as a kit. And I'm going to show you in a second some of the other solutions that are similar to this. And then there's different levels of thermal imaging that can detect elevated body temperature. And, you know, the idea that you can have solutions of all ranges. I mean, we have a solution by FLIR. Solution starts at $10,000. Not everybody needs a $10,000 solution to deploy at their facility, but you may have a facility where there's hundreds of people coming through your facility certain times a day. So it's important to get the right solution for your environment. And so I'm going to get out of this screen and show you some of the other solutions that people are considering and implementing today. So we just talked about the fever solution, and I would say probably 90% of our deployments are with this. Easy to turn up, comes in a kit, probably 15 minutes to put it together, and you're up and running almost immediately. Great for a lobby environment. You have an attendee there, a receptionist that can immediately identify if someone was in that range of body temperature. Other solutions similar to that come in a kiosk type format. Same scenario, walk in front of it, gives you an elevated body temperature, and you can make an informed decision immediately. Some other solutions to consider. I bring up FLIR because they're a leader in this industry. They've been doing it for decades, and I mentioned to you there are other solutions, and when you talk about their A400, A700 series, this is more of a fixed application where you can mount this on a wall or some kind of mounting device where you have line of sight that people are walking in. And it is best practice for people to come in to this, in front of this device in a single line, but you can have multiple people enter the field of view at one time to get a reading. So you can't have that happen, and it will take that temperature as people are coming through that. And I have a video, quick 1-minute video to show you guys how this can be used. So I wanted to share with you how this is being implemented and a lot of the folks that we are talking to. Just to give an idea, several thousand of these kits are being moved weekly into people's workspace. So again, this is just one way people are using this technology. It's just another screening protocol that people are deploying. So occupancy levels. We know social distancing is not going away, and there's sensor technology out there today to help with companies and schools and anywhere where there's heavy foot traffic that want to limit the capacity levels of certain areas of the facility. And this technology will give you real-time visibility on how many people are in your facility. And I was going to show you with a couple slides how the technology is utilized, how it works, and then I was going to show you a live dashboard of what this looks like. And so, having said that, you can see this is the sensor. Pretty slick sensor that we can put above entrances and exits. Easy to deploy. It's powered through a Cat6 device from your switch, so that provides power to the sensor. And it utilizes infrared technology. And so in real time, it uses algorithms and takes this data to the cloud, and it takes that data to a dashboard that you have visibility to know how many people are in certain areas of your facility. So how are people using this? So people are at times showing on the content on displays, so you can get some digital signage. So people have situational awareness where you know, people are thinking about walking into a cafe or walking into a conference room, and they can get a notice like you see here, wait, room is full. So you can get messaging out to displays that show where your occupancy levels are. We talked about, and I'm going to show you here in a second, how you can set up alerts. And obviously there's a mobile feature with this as well. So if those target capacity levels have been reached and exceeded, we can immediately get informed with a text or email, and we can come down to the area, remind people of our policy, and continue the social distancing effort that we have in place. So there does have some alerting capabilities in this. And this is just one snapshot of the kind of messaging that you can get at certain areas of your facility utilizing this technology. We just talked about how this can be used with live dashboards. The use cases of this are endless when it comes to this people counting. As far as scheduling usage-based services, do I need to increase the frequency of my cleaning staff? I get updates if conference room usage has peaked throughout the day. Do I need to add frequency of when we clean those areas? So the use cases in the near term are pretty amazing, and I'm going to switch over to a live dashboard. And so this is a live dashboard of the occupancy sensor technology, and on the left, you can get visibility into multiple locations, multiple buildings, by floor, by office, by room, whether it's a cafe, a boardroom, and this gives you a snapshot of day of week, by month. It gives you a history of your occupancy levels. You can also set target capacities of your facility. For example, I'll give our building, before this all started, we had several hundred people coming and going in our facility, and we set a target capacity in the near term of 80 people. And you can get a live dashboard, as you can see over here to the right, of how many occupants are in the facility today. The other thing that is great about this is you start getting real-time data and historical data of how your space is being used by the hour, by the day, by the week, by the month. So as you are starting to collect data, you can make some informed decisions on how to use the space going forward. And so you can see here the insight and the granularity and visibility of what your usage is for certain areas of your facility. If you have to increase staffing levels for certain areas of your facility, you can do that. If you need to increase, like I said, cleaning services because you saw peak occupancy levels. But how you use the data and translating that into some informed decisions, whether it's a real estate, occupancy, you have a lot of this data right here with this type of solution. Here you can see in real time the occupancy of any space that you have this deployed. Jessica, if there's not any more questions, I was going to move out of this and introduce Greg to the team, and he's going to share with everybody about the RTLS solution, and then we're going to come back
Sure.
to the
solution. So I do see one question here going back to fever. What is the accuracy and reliability of fever?
Great question. So the accuracy level is up to 0.4 degrees Fahrenheit. Great question.
Okay, I think we can move on to Greg while we wait for a few more questions to come in.
Sure. So Greg, I'm going to hand this off to you.
Okay. So we're gonna dive into a little bit of real-time location services and contact tracing. Contact tracing might be a new term for people, but if you haven't heard of it, you're going to hear a lot about it on the news and everywhere else. It's going to be an extremely hot topic for people these days. So RTLS, real-time location services, what is it? It's the ability to track people or assets in real time. There's been a number of use cases pre-COVID for it. And then now what they've done, what contact tracing is, and how we're leveraging RTLS or real-time location services moving forward is to try to help provide a tool for us to start to track those interactions that happen between people as they move between a facility, whether they're indoors or outdoors. And the idea behind it is based on CDC recommendations. If someone tests positive for COVID-19, typically you're going to want to look at who they've been in close contact with and actually look back as far as maybe 2 or 3 weeks. And if you think about how you would do that today, without the technology behind it, it would be extremely difficult. So imagine John Doe, calls HR and lets them know that they've tested positive for COVID, and then imagine the conversation that needs to be had about trying to recall all the people over an extended period of time that person may have come in contact with. So obviously a really daunting task. So people are turning to technology as a way to try to solve that problem. So high level, DataVox works with a number of real-time location service infrastructure providers. We'll talk about a few of those here just in a second. And then we work with a number of different application or dashboard and reporting type providers, and the two of those together ultimately delivers the capability that people are looking for. If you haven't already been talking about this topic or thought about some of the ideas and ways that you would use it, here are some of the things that we're hearing from our clients, as well as some of the things that the various providers are bringing to market. And depending on your particular use case and scenario, some of these solutions, some of these capabilities may be things that you want, and others may not be applicable for you. And that's where we go through that matching process of understanding what's your particular business application, what capabilities are most important to you, and then matching that up with the right solution. So we'll hit on a few of these. One of them, the first one there being daily well-being check-ins. And the idea behind this isn't really contact tracing. This can be done in a number of different ways, but a number of the contact tracing providers are thinking about ways to build this functionality in. And the idea is, how can I deter someone from coming to the office when they have symptoms or feel bad? Maybe it's not even COVID-specific symptoms, but they're just not feeling very well that day. And how can I stop the problem before it becomes a problem, before we start to infect other people? And so there's people out there that are using either SMS messaging, text messaging, or mobile apps with notifications, so that a particular user or all the users in your environment can get daily notifications that just ask them, hey, are you feeling good today? And just have them give that reassurance that, yeah, I feel good, and maybe if you don't feel good, giving them that encouragement to stay home, work from home. With so many people being laid off in the economy, what it is, I'm sure people, they understand the risk and are wary of that, but also are probably wary of the fact that they want to contribute to the organization and be in the office as much as possible. So the daily well-being check-ins is something that we've seen a call for. And then kind of getting into more of the contact tracing specific applications and how we leverage real-time location services, looking for automated creation of reports and dashboards that show who an individual has been in contact with over an extended period of time. And that may be just you may only care about first level interactions, or depending on your risk tolerance, you might want to know even second and third level interactions. And these solutions give you the flexibility to go into the dashboard or the reporting tool. And let's just back to that example of John Doe test positive for COVID. He lets HR know of the situation. The scenario would be that whoever's in control of the tool, HR or otherwise, would go. They would search on John Doe. They would set the time frame for which they want to search. Maybe they want to do a few days. Maybe they want to do a couple of weeks, maybe even 3 weeks. And then they can also set parameters around, what do they determine as a close interaction, how much distance between individuals and even how much dwell time. So is just passing somebody in the hallway close enough to be worried about and to alert other people, or should you need to be near that person for an extended period of time? And that these law guidelines are being established as we go. Some people, like if you're very risk, very low tolerance for risk, you might want to do pass-by engagements. If you're but as we go along, you might see something developed where it may go from, say, 2-minute engagements to 10-minute engagements, but you'd have the flexibility to determine that. There's even kind of moving on past that, there are solutions out there that are driving toward immediate notification of social distancing infractions. So, whether it be a mobile app with a notification on a mobile app, or whether it be a wearable type device like imagine like an Apple Watch or something along those lines, that when you get within, inside of those social distancing guidelines, say inside 6 feet, that the user is immediately notified that you're inside that distance, and so it just kind of warns the users to create some distance and hopefully keep the spread of infection from happening. Journey mapping is the idea behind journey mapping is not only monitoring when people have interactions directly, but also a scenario where John Doe tests positive. You go back and you search, for who he's had interactions with, and that's great. But you might also be concerned with, say, that person was in a conference room, and immediately after his meeting, another meeting started, and there was another, 2, 5, 10 individuals that were in a meeting space that was immediately following that, the previous meeting. And so you might care about that, and you might also want to notify those folks to self-quarantine, or at least start to monitor their health status. These solutions can be applicable for both indoor applications, outdoor applications, or both. And so that process there is just us understanding your business requirements, and then mapping the technology to that. And then lastly, I'll just say that as you're thinking about these things, the other thing that we're finding our clients are wanting to take into account, depending on their business, is how visitor friendly is it. So things like the difference between having a mobile app on your phone versus maybe a wearable device. Maybe it's just a badge that hangs around your neck, like your security badge. And some of those things are more portable to visitors than others. And obviously, as visitors come into your facility, those are important things to know. So as far as real-time location services are concerned, I think Mike alluded to it earlier, this is not new technology. We've been leveraging this technology in a number of different use cases for many years. The primary technologies that are used to track people's location are Bluetooth, Wi-Fi, GPS, ultra wideband, which is a developing technology, still a bit expensive, we think, for the market, but has a lot of promise for accuracy in the future, and RFID. What we're finding as we go through this journey is that the predominant indoor-based location tracking solution that's going to market is Bluetooth-based. And that's, Wi-Fi, you would kind of be naturally, you'd naturally think of Wi-Fi as a great platform to do that. Most environments have Wi-Fi today. The challenge with Wi-Fi as the primary tool for location tracking is that to track people's location with the accuracy that you would want for a contact tracing solution, it requires an extremely dense Wi-Fi environment. And it also requires a very specific design that supports triangulation to be able to determine where somebody is within that wireless environment. Wireless access points can be fairly costly individually when you get to that kind of density. So Bluetooth is a less expensive way to deploy location services and tends to be the leading solution in the indoor space. GPS certainly has a play here, and where GPS, where we find that to be most effective, is in outdoor applications. So think about construction sites, think about plant environments, think about college campuses, these types of things where you want to track interactions outside of an indoor space. GPS, it can potentially be done with Wi-Fi, but again requires a lot of access points and purposeful design there. Whereas GPS leverages the satellites in the sky, and there are certain limitations of that. GPS isn't as accurate, generally speaking, as Bluetooth can be, and GPS doesn't handle indoor applications very well because GPS can't determine whether there's a wall that separates you and somebody else within a facility, and GPS can't effectively tell you whether you're on the first floor, the second floor, the third floor, and so forth. So a number of different technologies that are leveraged for the real-time location services. One of the things that you'll see in the market, I mentioned, if you haven't heard that term contact tracing, as you turn the news on, you'll probably start to hear the term, very soon. And, it could be kind of a polarizing thing, in a number of different ways. But you'll hear that Google and Apple are also coming out with trying to bring solutions to market that are leveraging their mobile devices and using Bluetooth handshakes to track interactions between people. There's also a GPS component of it. The idea behind this, is great. Obviously, there'd be no cost to individuals for it. The challenge with it is that it's an opt-in model. It provides no visibility to the organization, and we think you're going to find that a lot of people are, anytime it's driven by tracking the mobile device, people get very leery of privacy concerns. And so although you'll hear these solutions out there, we don't see it as a viable platform for the enterprise and to give you the control and visibility that you're going to want. So the sort of the history around real-time location services is where these things have been used, sort of pre-COVID application. The biggest industry was probably hospitals. The solution has been used for years to track valuable assets and healthcare-based equipment, as well as to track patient interactions as they navigate within a healthcare facility. How long was somebody in waiting in the waiting area? How long was somebody waiting in a patient room before a doctor was there to see them? So they've been for years really focused on how to make the patient experience better. Where are patients? It's heavily used in senior living facilities and tracking where individuals are within a facility and the fact that they're active on a daily basis. So there's a number of use cases in the healthcare space. It's also been heavily utilized in manufacturing plants, chemical plants, those types of things, to know where individuals are. There's mustering and safety applications behind it. There's even devices that have man down type capability where you push a button if you need help, or even gas sensors that can sense gases in the air and then notify people, those types of things. So a number of different use cases. A few others are around tracking things in manufacturing, pieces and parts through RFID. So it's a very mature technology, and what you found is that there's just these individuals that have been in the space have sort of pivoted very quickly to introduce and leverage the technology and the data that's already there with these solutions to then answer the COVID contact tracing application. So to kind of speak to the maturity of the industry, Gartner has a magic quadrant for indoor location services that they publish. This is it on the left. DataVox has partnered with a number of these providers that you can see on the right, and they all play different roles in the overall delivery of a solution. We won't touch on all these, but you're probably familiar with the names Cisco and Aruba, the two leaders from a network and wireless infrastructure perspective. And so they play some part in the overall structure, can play a part in the overall structure of location services because they provide the Wi-Fi capability. They can also provide some Bluetooth type capability as well. If you look at SynTrack and CarePredict, these are very healthcare specific. Blackline Safety is a very industrial specific application around plant environment. So all these various providers have a overall provide a component of the overall contact tracing solution. One of the ones we'll talk about in a little more detail here in a second is the HID offering, which we see as just an ideal solution for the most common use case, which is indoor office space, and we'll talk a little bit about that in just a second. And so here we are. So the HID, you might know, they're the leading provider in card access, so control access, the badge that you use to get in and out of doors, in and out of facilities. Many of you may already have one of these, on you today. I'm wearing one around my neck right now. They acquired an organization called BlueFi that brought them into the real-time location services space, and they're actually one of the leaders on the previous slide in the Gartner Magic Quadrant. And their specialty is leveraging the Bluetooth capability to provide these location services. So if you look on the left, you'll see a couple of what they call gateways. And these devices, they come in two different form factors. One of them is a Bluetooth gateway that plugs into an electrical socket. It twists locks so it doesn't come out of place. And the other one, it can be ceiling mounted with a cover. So imagine a smoke detector type, looking device. Those communicate to Bluetooth beacons that are worn or held or carried by individuals. And so it could be something as simple as a card that looks like card access, something more sophisticated that provides a man-down type functionality with a button on it so that if you needed support, you could get it. Not really a COVID application, but as you think about how you invest in this infrastructure and how you might leverage it, continue to leverage it for different use cases moving forward that might be applicable, or maybe a key fob of some sort. So different form factors depending on what you like and what you need. But the user uses a Bluetooth beacon. The Bluetooth beacon communicates in real time and on an ongoing basis to the gateways, and the gateways connect to your wireless environment. So in this scenario, your wireless environment and the quality and health of that is certainly important. It's the way that the gateways communicate out to the cloud. So you do have to have a wireless environment in this particular use case, but the wireless isn't being used for real-time location services. The wireless environment doesn't have to be as dense. It doesn't have to be set up for triangulation. So this is how the HID infrastructure works at a really high level. One question that we commonly get is, can my existing card access device be used for this? They are different devices, and today you would need both your typical card access for access control and this new Bluetooth beacon card. The Bluetooth beacon card is slightly thicker. It's got a battery in there. One of the things we didn't dive deep into, but this leverages a little different variant of Bluetooth than your Bluetooth that runs on your phone. The Bluetooth that typically you're familiar with, running in your phone and connecting to your car, these types of things, that Bluetooth can send a lot more data to a lot longer range, and it requires a lot more battery life to do it, which is one of the reasons why you have to charge your mobile devices on a typically a daily basis. This the Bluetooth that's leveraged in this technology is called BLE, or low energy Bluetooth. And just as a kind of high level example, one of these cards, one of these Bluetooth beacons, without being recharged, can last 4 to 5 years. So on a different level of how long the battery lasts, and a few factors that drive why that is. So this is how the location information is tracked. It's sent out to the cloud, and then from that point forward, you can do any number of things with the data. There are dashboard providers, reporting providers out there that have adapted or built solutions around the contact tracing application, and the one that we would most commonly partner up with the HID solution is a group called Zulify. We could introduce both and have a conversation there, but there are other providers. You could even take the data and build your own reports if you were so inclined. There are some organizations that have very sophisticated security operations centers and NOCs and reporting capability, and they want to drive that data into their own reporting tools. So any number of different things is possible there. I'm going to real quick jump into, just to give you a visual, this is the tracking information within the HID solution. So imagine each one of these dots is a person that's carrying a beacon, and in real time we're tracking where those individuals are and how many contacts they're having and for what period of time. And then lastly, I was going to say that should there be interest, typically the process is we would have an introductory call, better understand your application. And as I mentioned, is it indoor, is it outdoor, is it both? What types of features are most important to you? And then we'll try to start to map that to one or multiple of our various partners in the space. And then we'll start to do some space planning. So this is a floor plan of the second floor of our building, and this is just the exercise that we would go through to identify the proper location for the gateways and the proper form factor for the gateways in the HID example. So this is the kind of density. As you look at these green dots, these will be ceiling mounted Bluetooth gateways that allow us to track in real time those location services and then ultimately the contact tracing application and functionality that we're looking for.
I guess before we proceed, Jessica, I just wanted to see if you had some questions that we need to address on the RTLS or anything else that's come up before I go on to this.
For the sake of time, I see one. Let's answer this one, and then we can move on to indoor air quality. What is the average installation time from start to finish for real-time location services?
Mike, you want to address that, or you want me to?
Greg, go ahead.
These are solutions that can be put in place in fairly rapid fashion. Obviously there's some planning. The size of the environment will vary greatly. So is it a large campus environment? Is it a 5,000 square foot facility? The technology applies to anybody, but obviously the level of effort could be significantly different. But I would say in general, the planning efforts and design efforts, you're typically talking a week to do something along those lines. Share the floor plan, the mapped out floor plan with you. Once you say go, you're probably looking, if depending on the size, an average size facility, maybe a project that could be executed on in 4 to 6 weeks. You've got the component of deploying the infrastructure in the facility, and then you've got the next step, which is then taking that data and then driving it into the reporting tool and designing that piece of it.
Okay, Jessica, anything else on RTLS?
I think we will save the rest of the questions for the end of the presentation, as we're coming up on time here. So. Okay,
I'll quickly go over this for the sake of time. And we're having conversations with facility managers, building owners about indoor air quality, and people are looking at their air filtration system, their HVAC system. Do I need to put an air purification system? And there's lots of tools to help monitor the indoor air quality. Obviously, it's important whether it's in a classroom setting, whether it's in your office space, whether it's in a nursing home, a hospital setting. IAQ is really front and center. And I just wanted to show a couple slides and then go to a dashboard real quick on how you can get visibility into the air quality of your space with simple sensor technology that's easy to deploy. It's quick, it's very cost effective, and it gives you visibility into where you may need to make improvements in some of those things I talked about, your HVAC, air ventilation, things like that. But this just gives you an idea of all the different particulate matters, the different air pollution, and in our space, it's measured in microns, and I wanted to show you this, and just to give you an idea, the human hair is 80 microns, and you can see how hard it potentially is to detect viruses, bacteria, things like that. Quickly, what causes poor air quality? Ventilation, poor HVAC systems, some of the cleaning supplies, building materials. It's interesting when we look at this pie chart, what's the major contributor to a lot of indoor air quality issues, and you can see with this pie chart whether it's building products, inside contamination, maybe people that are sick spreading the virus or germs, things like that. But the idea that you can have monitoring tools, and this is just a sample of one solution, and it's a sensor, and that is actual size that you can deploy it on the wall in certain areas of your facility, give you about 500 to 1,000 feet of coverage. And there's also clean room sensors that you can attach to your HVAC system. But the idea is that you will immediately get visibility in a number of those pollutants that I shared with you in the prior screen. This is a sample dashboard of what visibility you're going to get into. And I'm just going to jump into the dashboard right now. So this is what your dashboard could potentially look at, and this is the sensor and some of the air quality and particulate matter that it's looking at. Yes, your building automation system does a good job of looking at your temperature, humidity, and some other things, but these air quality monitoring solutions take it a step further and look at the volatile organic compounds that are in the air, the particulate matters that are in the air, and you can set thresholds based on ASHRAE and other building organizations on where that should be, and if it hits certain thresholds, you know to take immediate action. And you can get, not only is this in real time, but you can start getting historical data. This is just for today, but I can go back to May 24th. Maybe there is some reasons why some of these things have spiked. You know, CO2 and humidity, the idea that you can set humidity at certain levels to help minimize the spread of a virus. The idea that if CO2 levels are at a certain level, that may cause, you know, that sick building syndrome that would affect productivity, maybe cause some migraines and some drowsiness. So you all of a sudden have visibility into your air quality to get the data to start making some informed decisions about how your HVAC and building systems are operating. And these are some other samples of where the sensors are positioned throughout the space. I can click on these icons here and start getting graphical information down here of what I just clicked in real time. You can use the data to start making some informed decisions about your air quality. And you know, people want to know if you're doing everything possible in your space, and this is just another way technology can help that safe work environment. I know I went through that quickly, and Jessica mentioned we're up on time, but easy technology to deploy. It's another sensor technology that's cost effective. We can help support this not only during installation, but obviously post-installation, even provide some managed service tools to help with giving you visibility and giving you those alerts that you need to monitor your air quality. Jessica, I'll stop and see if you don't have questions. I know there's quite a few people that attended today, and outside of this, we can do a one-on-one session with anybody, whether it's the RTLS, air quality, thermal, and some of these other things. We can provide, we can be a sounding board all the way up to an implementation of some of these technologies. So let us know how we can help. We'd love to be part of that conversation. Jessica?
Great. Yes, I see a question here. I believe it was in reference to the real-time location services. Let me see if I understand this question right. Do you have, I think it's, do you have to integrate with IT platforms? Or do you have integration?
Do you have integration with IT platforms? So I would say that the data can be taken to any platform that you need to take it to. So there are some organizations that have built dashboard platforms that they were leveraging for other use cases, and so they're a natural place and an easy button to try to take that data that's developed and then turn it into a usable format. But if you want to take that and integrate it into your own platform, it's available to anybody.
Great. Of these return to work solutions, which ones do you see businesses putting in place the most?
So it's interesting. We're obviously the thermal is right now, the occupancy is right now, and the RTLS is, Greg mentioned earlier, it's been an established technology for years based on those industries that you saw that use, but where it stands today, the RTLS solution is front and center. We're having conversations with people that have a large footprint, where there's a lot of foot traffic, campuses, single tenant buildings, but really it's applicable to any size facility. But I would say they're all getting equal visibility, but I'd say those three things are kind of 1A, 1B, and 1C right now.
Okay.
Good question.
And I'm not seeing any specific ones on my side. Mike, do you see any in your chat?
I think we covered most of the questions and the information on this. I will say that, the conversations that we're having are with multiple stakeholders, whether you're an IT, a CIO, an IT manager, a facility person, an HSE supervisor. It's affecting all industries, every stakeholder's involved in their committee or task force. And, we're just here to share with you what technologies we've had success with that people are implementing. It's interesting, a lot of the people we're talking to have come back to work in different phases. I talked to a friend that's in the investment banking business. They're not coming back till fourth quarter. We're talking to other folks that are an essential business that they've been up and running this whole time, and they need something more right now because, people were following the CDC guidelines and some of the government phased approaches, and now that their office workers are coming back, that they need to do something. So every institution is different. Whether you're K through 12, higher ed, an office environment, a plant facility, we're talking to people in different stages of their return to work. So it has been an interesting kind of new norm. I hate to say that, but technology can definitely support their effort, whatever they may be considering. And if you didn't see something today, this isn't the only thing that we're talking to our clients about. There's also work from home technology that we're talking to our clients about, because that's not going away. People are finding out that productivity is just as good as they was when they were in the office. So we're unique in that sense that we can touch a lot of things to help our clients.
And I guess a personal question on my side, of these solutions, which one do you think, or maybe one or two, would be, I guess, most important if you were adding it to your business?
I guess you have to ask the team, I guess when you talk to your team at your facilities and organizations, what's your near-term screening protocol? and how you're going to go about implementing that, whether it's for your employees, your visitors, your contractors, anybody that may be entering your building. And in the near term, obviously, thermal is being implemented as we speak everywhere. And some, depending on the foot traffic and the density of the workspace, the occupancy is not going away. And also the RTLS, because that technology has already been here and available. Now they're just overlaying what's possible when it comes to this real-time location services, whether it's for people or asset tracking.
Yes, and I would add, Mike, I mean, to me, it's a little bit like the cybersecurity analogy. You've got to have a multi-layered approach, and each of these solutions that we're talking about and introduced today kind of play a different part in a different layer of the multi-layered strategy. So you look at something like even something as simple as the wellness checks. That's sort of the before scenario. How do you keep someone coming, from coming to the office? The thermal imaging cameras is a kind of a during scenario. How do you keep someone from entering the office that has a fever? The RTLS solution in the contact tracing is after someone has become infected, what do you do about it to keep it from infecting other people and allow you to continue to stay, operate in, as much of an operational state as you can. And then the other components that we talked about, play different parts in that kind of strategy as well. So it's about building, not just right now and where we are and who knows what the future will hold related to COVID. It's about the future as well. And who knows what will come in the future. But it's about building these defenses and layers against something that we probably never thought we'd have to build them in against. So we had multi-layered physical security strategies in the past. We've had multi-layered cybersecurity strategies in the past, and this is a multi-layered strategy against pandemics and viruses. So it's just a new thing that we're having to deal with.
Okay, well, that is it for questions. Mike, do you have anything to close with?
Yeah, I think I just want to echo, just consider us a resource. We're in this every day, every week, and whether it's on a consultative approach and just giving a feedback to your teams, we'd love to help you guys out. To Greg's point, there's a whole range of things that we can help in the near term and just stack on top of these conversations, because some of these solutions will be with you long term as well. And the use cases are endless with some of this technology, as you can imagine. So we're here to support you however it makes sense.
Great. Well, thank you so much, Mike. And of course, we want to thank you all for joining today's webinar. As a reminder, the recording link for today's session will be emailed to all attendees 24 to 48 hours post-event. If you did enjoy today's session and would like to hear more, we do offer new webinars weekly. Please check our DataVox website for more information on upcoming sessions. And as always, we would love to hear your feedback on our events. Once this webinar has ended, you will be redirected to a survey page. If you could please take a moment to complete that survey before closing out your browser, we would greatly appreciate it. That concludes our session for today. Thank you to Mike and Greg for a great and informative presentation, and thank you all for joining us. Have a great rest of your day.